Hi, everyone. This is Dr. Vivian Asamoah, and welcome to another episode of Back to Basics. If you are watching this, it's because of you're part of our tribe, the Natural Gut Relief. My name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist here in Katy, Texas. Well, what does this mean? I am a board certified gastroenterologist, and I'm also a specialist in certified in everything that's integrative and holistic medicine. And today we're kind of going more the conventional route because I think it's the best of both worlds that leads to optimal health results, right? It's not just the conventional, it's not just the holistic, but it's a combination of both. And when it comes to screening and screening for colon cancer, I think you must start with diagnostic testing. There is no other test that gives you that is the gold standard and gives you the same kind of results. And I'm talking about genetic testing, right? Some people are doing Septin9 genetic testing. I'm talking about stool testing, even the Cologuard. Those are not the gold standard. So we are talking today and this week about colonoscopy. And every Thursday, I always invite a very special guest who's an expert in their field, who can really give us sort of like the nitty gritty about what we have to know. And I always, and this Thursday is no exception, we have a very special guest, and that is our the head of our business administrative team, and that's Shannon Pittle. Pittle, am I saying it right, Shannon? Pittle?
It's Patel.
Patel.
A lot of people say it that way.
It's Shannon Patel. And Shannon is an expert at what she does, which is everything insurance related, right? Related to the facility that she works at, which is the Zazen Surgery Center. So this is an ambulatory surgical center. And who best but Shannon to really tell us about, the cost, right? When it comes to insurance, the nuances in terms of insurance whenever it's time to schedule your colonoscopy. So we're going to go down and dirty here. We're just going to talk about all those common questions that patients always ask. But I want to take a minute and thank Shannon for being on with us. I know you're busy. You've got a busy schedule. You're typically crunching numbers. Tell us, Shannon, a little bit about what you do. Tell us a little bit about the Zazen Surgery Center. And I heard there was some recent updates in terms of open access scheduling over there.
Absolutely. We've been quite busy, as you know. We've been collaborating with you as well with our direct access program. But a little bit about Zazen Surgery Center. We are a AAAHC, which is one of the highest accreditation boards for ambulatory surgery care, surgery centers. We are accredited. We've been accredited consecutively 2 surveys in a row. We are primarily endoscopy. So we really know the ins and outs of colonoscopy, EGD, the costs, all of that. And so what I do basically is make sure that we're staffed, oversee billing, act as a liaison between patients and their insurers. Every aspect of the surgery center I'm in somehow.
Yes.
Every aspect.
The aspect of the surgery center. So when it comes to when patients have billing questions, I know very often first it goes to the front office, but usually when it's a more complicated issue or if there's a nuance, I know it ends up on your desk, which is why I think you are the best person to really be able to provide some insight. We'll talk a little bit more about the direct access colonoscopy protocol towards the end, but let's jump right into, I'm going to start with the questions that patients always ask, which is, Dr. Asamoah, I had polyps on my colonoscopy 5 years ago, or maybe 3 years ago. And I was told that I need a repeat colonoscopy to go in and detect more polyps. Now, Shannon, is this going to be a screening colonoscopy, which is fully covered, so that would be preventative coming out of your insurance, or is it diagnostic, which would come out of your deductible? Because generally, what patients are trying to get me to do is switch the code. We get this question very commonly. Why don't you make it a preventative? My insurance said if you made it a preventative, I wouldn't have to pay. Shannon, break it down, because I am very often not successful telling my patients. So you tell us, what do the insurance companies say?
Yes, exactly. So it would not technically be a screening. You've probably already had that screening. That screening was covered. Unfortunately, you're coming back for surveillance, and that is not considered a screening. It is considered diagnostic by insurance companies. Now, in my heart of hearts, and more than likely in Dr. Asamoah's as well, it's a screening. Unfortunately, insurance does not view it that way. So it would go towards any applicable deductibles and cost shares, which are negotiated at a contract rate between the facilities providers, anesthesia providers, and pathology, should there be any.
Yes.
What they've negotiated with that insurance company, broken down to your deductible and any cost shares, which would be like your co-insurance after deductible, that could apply.
Yes. 100%. So, the American Gastro Association, the American College of Gastroenterology, lots of gastroenterology groups, as well as, lots of people, our representatives. One of our congresswomen, notably Debbie Dingell, is leading 45 members of the Congress in this effort, backed by 95 medical societies and organizations, to remove this cost sharing to patients when they have polyps, right? So they're trying to pass a new bill to try and remove this because it's not fair. But it's not fair. It's not fair that just because you had polyps and just because you actually are the one who needs that preventative screening, that your insurance company is kind of turfing this bill to you. But from our perspective, we have to follow what the current policy and guidelines say. We have to bill it as a diagnostic procedure, a surveillance colonoscopy. So I hope this is really clear for everybody. The Congress is working on it. Gastroenterologists are working on it to change the bill. But the reason why we cannot lie,
Right.
really,
Well, you can. It's fraud.
this
So
is because we are audited, right? And our documentation is there. Like if I see a patient and it says history of colon polyps, and I get the records and I get the colonoscopy and I get the pathology report, we can then now call it a screening, right? So we all have to do whatever we can. And we at Houston Gastro Institute are doing the best that we can to support the Congress and support that this bill passes. But until then, it is a surveillance, a diagnostic, and this will come out of your deductible. Correct, Shannon?
That is correct. Okay. If you do have applicable deductible, it would apply towards deductible, not like your initial screening, what they would consider the only preventative at age 45 or up if you've never had one.
Very good. Now, I do make some exceptions and nuances for some patients. So, for example, if a patient tells me, I had my procedure 10 years ago, I think there were polyps, they're coming in 10 years later for colonoscopy, I bill it as a screening. Because at this point, my patient can't even remember, and they've already met that 10-year mark, right? So that's one case where it's been 10 years, I have no documentation, I'm just going to bill it as submitted as a screening. The second option, the second category where there is nuance is if when my patient says there were polyps, if they have the pathology report and I can see that on their pathology report, the polyps that they're mentioning are not precancerous polyps. They were just sort of benign hyperplastic polyps that we see in several people with getting colonoscopies. I also count it as a screening because those polyps don't count. We don't necessarily survey hyperplastic rectal polyps. So I usually leave those as a screening. And so I'm very clear to my patients when I do a colonoscopy and I find polyps, I'm very clear in explaining what type of polyps they are. I say, well, this is precancerous, this is hyperplastic, benign, doesn't count. It's almost like you had no polyps, right? And so if I'm able to find the documentation or a patient is able to show me the documentation that they were benign hyperplastic, that's my second nuance. I will bill this procedure as a screening so that they don't have to incur the cost, right? If it's been more than 5 years or whatnot. Okay. Correct. All right. So that's good. So we can't lie, we can't fib, we are audited. It is the law. This is not the fault of the physician or anyone, right?
No, it's really not. It's not at all. And I'm happy to hear that that they're trying to make a difference.
To make that, it's just a change. It's just the legislature. Now, Shannon, another question patients always ask is, okay, so when it is a screening, whether it's a screening or whether it's a diagnostic procedure, what are the bills I would say, what are the services rendered at the time of a colonoscopy, right? Which
Right.
is what would explain the different parts of the bill. Could you tell us a little bit about that?
Yes. So potentially there could be up to 4 bills for your one procedure. So it's one procedure, but there's going to be 4 separate bills from 4 separate entities. You're going to have the facility bill, the physician that performed the procedure.
So the facility, hold up,
Okay.
surgery center or hospital, right?
Correct.
Where,
Surgery center or hospital, just the place that the service takes
okay.
place in.
Mhm.
And then you'll have ASC or hospital, which you'll see a huge significant difference in cost between ASC and hospital. So about 55% cheaper to have your procedure done at an ambulatory surgery center versus a hospital. You're still going to have the physician bill and the anesthesiologist bill. And if there's any pathology, this is where you may or may not receive a bill, just depending if any pathology was sent to a lab. So when it's screening, all of that, and it stays a screening colonoscopy, all of that combined would be covered at 100%. Diagnostic, you could receive, there could be patient cost share on 4 separate entities.
Okay.
I think it's important to realize a lot of patients ask, well, is anesthesiologist in network?
Okay.
Are you guys in network with my insurance? How do I know? The anesthesiologist, we looked them up, they're out of network. Well, under what's called RAPL, it's like a clause in insurance, where if the physician and the facility are both in network with your insurance carrier, doesn't matter if the pathology lab or the anesthesiologist is out of network, they will be paid as an in-network provider, as long as your physician and your facility are in-network providers. And so that clause helps you from getting surprise out-of-network bills. So where you really want to focus on making sure you're not going to use your out-of-network benefits or stay in network is make sure the physician performing and the facility it's being performed at are in network. All other bills should be included as in network as well, whether they technically have a contract with that insurance carrier or not.
Excellent. Okay. So you said a lot of things. We're not insurance people. We're not business admins. So I'm going to have to repeat some of this, because we really want to be very transparent about the services we offer. There's no hidden secret here. So when you're getting a colonoscopy, you will, whether it's diagnostic or screening, because some people are like, oh, mine is a diagnostic, mine is a screening. Are you going to do something different? We don't do anything differently. Right? If we see polyps, we remove them, whether it's a screening or diagnostic or whatnot, right? So that the procedure in itself is the same, okay? So, and the services we provide during the procedure are the same. But there are 4 components of the procedure, or I guess 4 people or places involved. 1, the facility where you're having your procedure done, surgery center versus hospital, right? And interesting to note, and we'll come back to this, Shannon, that the hospital cost is it's greater than 50% than doing it at a surgery center. So you pay a lot more when you do your procedure at a surgery center, at a hospital.
At a
right?
hospital, correct.
So it is more cost effective for you, for your insurance, and especially when you're getting a diagnostic procedure where it's going to come out of your pocket, to have this, if you can, and if you meet criteria, at a surgery center, right? So there's facility fee. There is the physician who's performing your procedure, who should be a board certified gastroenterologist. And I will tell you that that's my bill. And that one is probably like the lowest number on this thing, right? It is the smallest.
I believe so. Yes, actually.
And then there is the anesthesiologist's fee. And what Shannon is telling us today is that, the 2 most important things that you should be checking for is whether your physician and your facility is in network. Because according to this RAPL,
RAPL, RAPLE, radiologist, anesthesiologist, labs,
etc.
That would be included.
If your facility is and your physician are in-network, they will then apply the in-network rates to anesthesiology and potentially pathology, right? So that should not be an issue, right? Okay. All right. Especially like in terms of your screening, notably, right? So like this also applies to, so those are the two other bills that you'll get: facility, physician, anesthesia, as well as lab pathology if specimens are removed. So I wanted to make note that if you're going in for a screening, right, and your doctor has to remove polyps because they found polyps, that too will be covered under the RAP law. And you won't have to, that is fully covered, right, under the RAP. And if you are working with maybe an anesthesia group that's out of network or a pathology group that is out of network, under the RAP law, it will be covered as in network. Is that correct?
That's right. Yes. And again, it stands for radiology, anesthesia, lab, and pathology. So RAPL.
RAPL law. Okay. So that's really, really good to know, right? Because I have had patients getting a screening a diagnostic procedure, and they're like, well, this is Dr. V, this is going to come out of my deductible. So if you don't see anything major, don't biopsy, because they're concerned about the pathology bill. Okay. Just want to say, I said, well, we have to do our job. If we see something abnormal, we have to remove it. We have to biopsy, we have to sample it so we can provide answers, right? And it's also important that you're working with a physician who is sampling adequately, because some of this sampling, like the more samples you take and the more specimen jars you take, the more expensive it is as well, right? So you have to work with someone who's within reason of not taking too many specimen jars. Like I take what I need. I really try and just take what I think is going to be relevant for the patient so that they don't incur more cost, right? So that's really important. But we can't go in there and see a large polyp and not remove it, because then what's the point of doing the colonoscopy?
Exactly. It would just say, oh, we see it. Okay, never mind. That's it's pointless. You may have
we don't do that.
Yeah, not had it at all.
We must. So this is really important for you guys to know as health consumers that, hey, I need to connect with my insurance. The RAP law exists. Can this bill be modified in any way? Does it need to be, do modifiers need to be added to my code so that they know that exactly this procedure needed to be done, right? So that is really important. So some really interesting questions that are coming up, Shannon, because we hear this all the time from our patients, right? All the time from our patients. Another question that I had was when it comes to payment, right? When it comes to payment of all these bills, when should we expect them? So just say Vivian, 45, getting a diagnostic colonoscopy for abdominal pain or rectal bleeding, right? So I schedule my procedure at Dr. Asamoah's office, and then I'm told that my facility fee, I'm told that the physician portion is this amount, right? And then subsequently, what other fees, and my office will collect beforehand, as we do, what other phone calls, what other fees should they expect to receive?
You should also expect to receive a phone call to review your benefits and go over any potential cost shares from the facility. So a representative at the facility will verify the benefits of the patient referred to us, review what they're having, apply that contract allowable based on their insurance carrier, and determine if there's any cost share for the patient. We try to give, the best estimate. Again, it's just an estimate. And then we would notify the patient if there is a cost share for that diagnostic colonoscopy, and, whether they could pay up front, or we do offer some payment plans, but just give them a rough idea of what, this is potentially going to be. And again, anything beforehand is an estimate, because if you go in and there's, more things like an additional code, or you use,
we do additional procedures in terms of or snaring or dilating or something like that, right?
Exactly. That could change that cost. So you may have, your bill may be higher. You may have a balance afterward. But that's just dependent on the procedure itself. But Don't
Okay.
let that scare you away either, because,
Yeah.
it's important that you get this done.
Yes.
And, at Zazen Surgery Center, we do offer payment plans so we can
Okay.
help you should you receive that surprise. And that's when you would ask for me, and we
Yes.
can go over everything, and we'll take care of it.
Awesome.
So,
Awesome. So I know they hear from, of course, my office will collect the physician's part,
mhm.
and then facility, they will hear from your team after insurance to go over the benefits and any cost sharing there. I know
Correct.
they will also hear from the anesthesia team to go over cost sharing expenses over there. We have selected an anesthesia team that has, one, excellent anesthesiologists, very, very good at what they do, and two, the most affordable rates for our patients who are having to pay something out of pocket. We intentionally chose an anesthesia team that did not have a high charge master, meaning that they gave us really the best rates that they could. And we've compared this to many, many other groups, especially hospital groups, in terms of that. Now, when it comes to pathology, Shannon, when should they expect that if tissue samples are taken?
If tissue samples are taken, I would say you would probably receive a bill, if there is a bill or a balance for the patient, within about 30 days. So normally what happens is it may take a week before the pathology submits the bill, because it takes a week for them to do what they do, right?
Yes.
It may sometimes less, but let's just say average 5 business days. So in 5 business days, they send their bill, their claim to your insurance company.
Okay.
Generally, a clean claim is completed within 30 days, but usually it's about 15 days. So between 15 and 30 days, your insurance company will send an explanation of benefits, or an EOB, to the pathology group. The pathology group will then apply whatever your insurance paid. Should there be a balance, then they'll send you a bill. So I would say typically you'll receive that bill in about 30, maybe 45 days, but the claim should have processed within 30 days of submission to your insurance company.
I see. Okay, so this explains why we get all those calls back. We get a lot of callbacks after the procedure is done. Like they're like, "Oh my gosh, Dr. V, I got another bill," and we're like, "What are So and it's usually like a month later. So it does
Right.
take a while. But factor in that not everyone getting a colonoscopy will have a pathology bill. We will we will take specimens if needed, right? And so those specimens have to go through a process. So right after your colonoscopy, if the doctor tells you specimens were taken, if yours was a screening, it should be covered under your insurance, right? That should not be an issue, right? According to the No Surprise Act. But if yours was a diagnostic, just remember, there are 4 bills you will receive. These are 4 different entities, 4 different people involved in the procedure, right? So if yours was a diagnostic and specimens were taken, do expect some cost sharing there for the pathology lab and the pathologists, different physicians who are reading those specimens, analyzing them so they can provide us with answers in terms of the performing endoscopists, in terms of how to treat you or what the next step is. So that path bill is typically the last bill you receive, right?
Correct.
Okay.
Yes, because at the surgery center, we typically submit claims the next day within 24 to 48 hours.
Yeah.
So, our claims will process faster, which means we'll get that EOB, or explanation of benefits, and payment from the insurance. And then again, any balances would be mailed to the patient. So your first bill will probably be to whomever filed the claim first.
Got you. And it's very possible that by the time pathology files that claim, you've paid, if you're having a diagnostic procedure, you've paid the physician, you've already paid the facility, you've paid anesthesia. Depending on where you are with your deductible, you may or may not have met your deductible, right?
Correct.
And not necessarily have anything to pay. So I actually think that 30-day window is good, right? Because all the other claims would have gone through first.
Correct. And you have a more accurate understanding of where you are with your insurance and your deductible as well.
It's still a lot, though, don't you think?
It is a lot to take in.
It feels like a lot to take in. I wonder why we can't just simplify this, and just. But I would say, Shannon and I have been kind of looking at the numbers. And, we asked ourselves last week, why would anyone get a procedure at the hospital? If you are a healthy 45-year-old, 60-year-old, or 70-year-old, right?
Right.
And you decide you're going to work with a hospital physician. Number one, I believe that your charge for that hospital physician is going to be higher. We're assuming it's probably all about 55% higher. This is just a rough guesstimate, right? Your
Right.
charge for the physician is going to be higher. Your charge for the facility, Shannon calculated, was definitely 55%. I would say even more, Shannon, but your numbers were.
Yeah, based on a national average. Now, some demographics, and more than likely the Houston, Katy area is going to be higher than the national average.
Yes.
So again, I don't want to give out estimates that I don't know, but if you do look at it nationally, it does say 55%. And Houston, I would say 70%.
70%. I would not be surprised at all.
I would not be surprised.
So your cost for the hospital is going to be higher. The facility, of course, the hospital has a much higher charge master. Your cost for the physician doing the procedure is going to be much higher than an independent GI physician like myself. Your cost for anesthesia is for sure going to be higher than our anesthesia groups that we use. And so sometimes I wonder, if this is a procedure that is easily done, sometimes in office in some GI facilities, and definitely easily done in an outpatient ambulatory surgical center that is AAA HC certified, very, very reputable surgery center.
Correct.
Why would you want your insurance or yourself to pay all this money to get the procedure done in a hospital? Now, there are some patients we choose to do the procedure. I myself go to the hospital to do some based on selective criteria, to do our procedures in a hospital. Shannon, can you tell us a little bit more about that surgery center criteria? Just maybe a couple, which patients you would not accept at a surgery center, which patients are higher risk, because at Zazen Surgery Center, of course, we focus on safety, efficiency, but patient first, right? Patient safety first. Safety for the patient, but also safety for our team, right? We want to make sure that we're taking care of someone who should be at the facility. So a couple of times, I know, Shannon, your team has said, Dr. V, this patient must go to the hospital. So tell us a little bit about that selection.
So if we have a patient with a BMI over 45,
body mass index. So this is based on
body
weight
mass
and
index over, correct, over 45, you more than likely want to do them at a hospital. Sometimes, colonoscopy, not always that BMI criteria. It's just dependent on the doctor, but that's where our baseline.
I know that the doctors are concerned about other risk factors, so very often they'll ask us to ask questions pertaining to sleep apnea, have them do the stop bang score, things like that. But there's a little leeway, but it's generally 45.
45,
right?
Correct. If your patient is on kidney dialysis,
hospital.
There's been a CABG, which is a coronary angiograft bypass in the last year, or stenting in the last year, then you may want to review that criteria a little bit more. Consult with their cardiologist and see if they could still be a candidate. So there are
our patients with defibrillators to do in the hospital, because generally they have a weaker heart. But our patients with pacemakers, we do at the surgery center. Prior history of stenting, old stents, we do at the surgery center comfortably. Of course, I prefer to scope performed endoscopy procedures for anyone who is being evaluated for transplant. I prefer to do it in the hospital because generally they have other issues. Some of them have already had a transplant. Like my cardiac transplant patient, my kidney transplant patient, like recent transplant, I prefer to do those in the hospital. I think one of the criteria is sort of like an informal criteria is age. We don't like bringing our elderly to surgery centers because,
which is 80 and up.
80 and up.
And that's
80
when you
and
want
up.
to look at all of their history, the
History nutshell, yes, yes. So 80 and up surgery is a hospital. Less than 80, we of course evaluate case by case, right? In our elderly population. So there is a clear criteria as to who goes to the hospital and who can come and get their procedure at the surgery center. But for the most part, what the insurance companies tell us, and I think what the Texas Society of Ambulatory Surgery Center also says, is that the care in the surgery center at an upstanding accredited surgery center is by far much better. Safety and efficiency for the patient also improved, and the cost is possibly 55 to 70% less having your procedure in a surgery center than a hospital facility.
Correct. And then
So
another thing I'd like to point out, and this isn't always the case, but there are some freestanding surgery centers that may actually be hospital owned.
yeah,
And those surgery centers are more than likely going to have those hospital rates as well.
yes,
So you really want to look at which surgery center you're going to,
yes.
because there are other surgery centers that could be more cost effective for the patient than, say, a hospital owned or hospital based surgery center. So
yeah, I think that's a really good point. And I think this is why we're having the conversation we're having today. And I think more conversations like this have to happen because patients are now shopping for the best rates and the best doctors, right?
correct.
And what I've noticed is that the best doctors aren't necessarily at the most expensive hospitals. I'll be honest with you, right? It's just a question of, who is the insurance, what kind of rates does the insurance have with this facility, right? It's the same procedure, guys. It's the same procedures, it's the same equipment, it's the same anesthesia teams that go back and forth anyway. So our advice, and I think Shannon, I've heard you say this a couple of times, is shop for the best rates. Make sure you are actually asking the questions about what's my pathology, what's my anesthesia, what's my hospital rate, what's my this. Shop for the best rates, especially if you're having to pay for it. But Shannon, let's go back and talk about, so what if I'm a cash pay patient? Let's end on a cash pay patient, right? Zazen Surgery Center has an open access system. Tell us a little bit about this. And it's a wonderful time to hear about this because, as you know, March is Colonoscopy Awareness Month. A lot of people will say, I can't get a colonoscopy because I can't afford it. I don't have insurance. I'm self-insured and I can't afford it. I want to first start off by saying that there are a lot of organizations out there that will actually help support you to pay for your colonoscopy. One of them is I think it's Colon Cancer Alliance Group, and I'm going to post that on. That's a big national group that actually gets our practice actually just donated to that group this month so that they could help patients who are trying to get colonoscopies. And actually, with the donation we made, we're going to allow 50 patients to get colonoscopies at a $25 rate each.
Nice.
Yeah.
That is wonderful.
Which is what I love. Like when you make the donation, they tell you your donation is going to allow 50 people to get a colonoscopy at $25 each, which is perfect. Now, the facility is going to get paid, but our donation is just helping other people, right? So my question is, for those people who say, I'm uninsured, I want to get a colonoscopy, but I can't afford it, what is the breakdown of the cash pay rate? Just give us an average, the total facility and everything in general. What's that number?
Okay, so for a facility, at our facility, for a colonoscopy, it's $1,010.
Okay.
I believe it's $200 for a physician or anesthesia.
Approximately, yes.
Yeah, about $200. I think the total for it all is about $1,700 off the top of my head.
And I'm actually checking my website because, of course, the bill comes from 4 different groups, right?
Correct.
We just updated ours on our website, and our bundled rate for a colonoscopy is under $2,000.
Under
It's
$2,000, and that's hard to find.
Yeah, that's
very hard to find. And so going into the direct access, what's great about that is, you know, how you mentioned the Colonoscopy Alliance and how they're helping, and you did the donation. What we have implemented at Zazen Surgery Center is our direct access colonoscopy program. And that eliminates the middleman or middle physician, that middle visit. So if you are self-pay or you don't have insurance, it's all coming out of your pocket. You don't have to go to a doctor to get that referral for a colonoscopy. You could just visit our website and submit a request. And within 48 hours, we can have you scheduled with one of our providers that's credentialed at Zazen Surgery Center. So that's one cost-saving way for self-pay patients. They don't have to go spend $300 for an office visit.
Visit first,
Get the referral for preventative service. And then our rates are for the area are highly competitive.
Absolutely.
And we do offer payment plans for a self-pay rate, which we would request 50% down, and then we can break up the 50% into 2 installments.
That's excellent.
Yes.
That's excellent. So the Zazen Surgery Center is now accepting direct access. So you just call the Zazen Surgery Center. What's your number?
You can visit our website. You can click the link on our website, and we will have you scheduled within 48 hours for your preventative colonoscopy. Now, there is a screening process. We have to make sure that you're a candidate that, you know, if you're having any problems, you would need to see a physician first.
Yeah.
But if it's just screening for preventative purposes, and you can use this if you're insured as well. We would file your benefits. You can get your preventative out of the way without having to see a physician first for a referral.
So I think this is really awesome that we can just go through the center and get this done. So I'm thinking the ideal person for this is, listen, my doctor said come back in 5 years. It's 5 years. I just need to get it done. Mm-hmm. I need to get my screening. I feel great. I have no issues. You know, go straight through the surgery center, skip the step of having to go through a GI doctor's office and this, that, because all the GI doctors work at the surgery center, like we're there, right?
Right.
So we would actually have skip that part, say, I just need to get scheduled, fill in the forms one time. The medical team at the surgery center reviews your forms and sees whether you qualify or not. And the surgery center takes over, gets you scheduled. You're in with one of the doctors, and they're all excellent. We have excellent doctors at the Zazen Surgery Center, all of them really excellent. So you will get scheduled. Some of our patients were like, I want an all-female team. Possible. We have 2 female. I want a guy. We have a male physician as well, a male gastroenterologist. So, and then we can get you on as quickly as possible. What I love about the center is that our wait time is very little, right? So if someone is like, hey, I have to travel, I want this done before 2 weeks, we can get you on the schedule, which is excellent, right? Absolutely. So someone walking in, just need a screening, or I had polyps, it's time to get this done, or I have a family history of colon cancer, and I know that it's my time, I need to get this done, without having to go through not just your primary care doctor, but then another GI who's just gonna tell you, yes, you need to get it done. Go straight through the surgery center, schedule it, boom, boom, you're done, get scheduled on one of the days that's very convenient with you, and you're all good. So I think this is wonderful. What is your phone number and what's the website for Zazen Surgery Center?
Sure. So our phone number is 281-869-3011. And the website is zazensurgerycenter.com.
Fantastic. We'll go ahead and post all of this in the comments. Shannon, this has been an awesome discussion.
Thank you.
We went really down and dirty, deep in there. All the questions patients ask, some of them very, very real and frank questions that I just wish the legislature would change. And the biggest one for me is, you know, why do I have to get punished because I have polyps? Not fair.
Well, when I first started in an ASC in 2012, if you had a polyp, you automatically, it wasn't a screening anymore.
Yeah.
You would be billed as diagnostic, even though you were scheduled as a screening. So it has come a long way. It just needs to come a little further.
It has to come a little further, right? Yeah. We talked about all of that. We talked about the cash pay rates. We talked about the option of direct access colonoscopy at Zazen Surgery Center. We talked about thinking through it. Why get your procedure done at a hospital instead of an ASC? If you meet the criteria, the hospital is 55 to 70% higher, especially if
you're demographic.
Yes, depending on your demographic, especially if you're working with a hospital employed physician who's scoping all their patients at a hospital, much more expensive, or even
Yes.
going to a hospital owned surgery center. So look into that
Yes.
as well. Look for
Yes.
the independent ASCs, right, that thrive in Texas. And we spoke about the different components of a colonoscopy bill and when you should get them, as well as the payment plans offered at Zazen Surgery Center. So I hope this has been helpful to everyone. Shannon, I thank you.
Thank
This has
you.
been super, really informative, lots of great information. I'm sure people will have questions. I think at the end of the day, it's important to say, there's value in getting your colonoscopy screening because the expense is much higher if you don't screen, if you don't get checked, and we never find out about that large polyp or that early cancer. And then after that, you say, I wish I had. I wish I had just paid the money. I wish I had just gone through it and gotten my colonoscopy. Trust me, just last week, I diagnosed a 51-year-old with stage 3 colorectal cancer, and she was 51. So this is another message, guys. I know I keep hounding, I put it all over social media. Get screened. The money is not going to make sense, 2 years down the road, or it doesn't make sense anymore the day after you're told, well, you have colon cancer. So the sooner you start screening, the better. Just make sure you're checking up on your cost, you're comparing costs, you're asking questions. You've now been empowered. You have the information. Ask the questions that you need to ask, okay? And we will be more than glad to help you. And Shannon, as business admin director at the Zazen Surgery Center, will also be glad to help, okay?
Absolutely. Any questions, just ask for me. I'm here.
Fantastic. Thank you guys for joining us on another episode of Back to Basics. Again, my name is Dr. Vivian Asamoah. I'm an integrative gastroenterology in Katy, Texas. And have a wonderful Thursday night. Bye.
Bye-bye.
Bye, guys.